Good day. Hi. Thank you so much for joining this webinar. My name is Jim Lawson. I do outreach development here at the American Board for Certification for Orthotics, Prosthetic, and Orthotics. I'm so glad to have you on with us today. We're going to take about 45 minutes. We're going to be working on preparing for mastectomy accreditation, everything you need to know. You will finish this and you won't need to know a single thing. Actually, to be honest with you, if you do have any questions whatsoever, we're going to give you our contact information. Call us, call our accreditation team, contact myself, whatever you want to do, get in touch with us, send us an email or give us a phone call. If there's any questions you have, do not hesitate to do that. So thank you so much for joining us today. We're going to get right into the meat of this. We're going to discuss what you're going to learn today. Let's kind of review this. We're going to go over what, whether it's your first time in the accreditation process or your second or third time for renewal, you're gearing up for it. Today's information should be beneficial regardless of where you are in your accreditation process. Today what we'll be doing is reviewing your boutique needs, and to do so before you prepare, and how to prepare for your accreditation survey itself and prepping for your survey. We're going to do a walkthrough of what will occur on the day of your survey and what will be expected of you and your team, and what to expect after it's all over itself. Also, we're going to talk a little bit about the secrets of success, the tips and the hints and suggestions from our surveyors and our staff, as well as a lot of examples that I've heard from other facilities and practices and boutiques about what works for them and how you can utilize those ideas for your own business itself. Now, one of the most important things we're going to review is the wonderful tools and resources that ABC has developed and put together to make this entire process easier. Now, before we go any further, I do want to make one statement here. I'm going to be using some terminology and some of the words I'm going to be using. I'm going to be using healthcare providers, practices, businesses, boutiques, facilities, fitters. I'm going to use all of those. Those are all healthcare professionals, and you fit into those categories. So I just want to make sure that everyone's on the same page for that. So, why accreditation? Some of you are saying, because Medicare and ABC is making me do this. Well, and that's an okay answer, but it goes a little bit deeper than that. So the accreditation itself, being accredited with ABC, encourages you and your fellow staff members to use our profession's best practices, the best that you can, and with that, hopefully you're going to save some time and money, but ultimately, most importantly, you're going to improve the health care that you provide to your patients. Now, we're going to discuss some of the ways we can achieve these goals. And accreditation by ABC is required by some payers, and it's required by CMS. And if you have Medicare patients, CMS is going to require your patient facility accreditation for your mastectomy services. And by following and adhering to the ABC accreditation standards, you can have definitely a great base as a defense for audits performed by outside organizations. It's a really wonderful way to make sure that you have everything in place, all of the documentation that is needed, that if the audit does come by. So your mastectomy team here, here's a couple of things I want to make, and I want to make this very clear. I want everyone to understand who is listening to this broadcast that you are a healthcare professional. There are times when I speak to different boutique staff members and owners, and sometimes of boutiques, they say and consider themselves lingerie salespeople or bra salespeople. You're so much more than that. You're so much deeper than that. I can't emphasize it enough that you are trained healthcare professionals who make tremendous positive changes in people's lives. So please don't forget that, and don't sell yourself short. So with that in mind, though, you are also held to healthcare professional standards. I want to encourage all of you to take pride in that, and you really deserve it. So please, please take pride in that. So let's talk about getting prepared, okay? ABC strives to make the facility accreditation process as effective and uncomplicated as possible for you. There's a couple ways we can do that. You can prepare for the survey on your own. You can do it in-house, have your staff doing it all together without any work whatsoever, and there's probably going to be a little bit of struggling. The second way to do it is ABC has created these many tools that will help you prepare for the survey even before you submit your application for the first time or your renewal application. It doesn't matter where you are in the process. Let's take a little time and review some of these tools themselves. So, number one, the Accreditation Guidebook. If you choose any of our tools, and I'm going to go through a lot of these tools here today, but if you choose any of them, you choose just one, I really encourage you to use this first, the ABC resource available. It is the Patient Care Facilitation Accreditation Guide. It's basically your owner's manual for accreditation. It informs information about getting started for the ABC standards, along with tips and hints on how to comply with the list of additional resources and tools that the ABC has available. Now, just a couple of years ago, we combined everything to create this one comprehensive guide for our facilities. Almost all of this information that we've created is right inside of this book here, except for some of the tools I'm going to show you a little bit later. We've worked hard to make them easier. What we've done is we've gone through some of the standards. We have not changed the standards, but we have rewritten some of the standards to make them easier to understand, really, that you're able to work with these standards itself. If you don't already have the guidebook, make sure you can download it from our website immediately after the presentation, after you've finished watching this, or you can contact us and we'll send you a hard copy for it. So, the Patient Care Facilitation Accreditation Guide. Now, we do have one tool that is not a specific tool, that is not in the accreditation guide, and the question is why? Well, it's an interactive tool. It's on our website. This is the relevant standards tool. Now, the standards tool has categories of products and services that you provide to your client. Let me show you real quick here. We have listed all the services that you can provide to your patients themselves. It's very simple. What you do, click on any of the that you provide. Here's breast prostheses and accessories. Click on that, continue scrolling down, go all the way to the bottom of the list, hit generate, and what that does is that pulls up a list of the standards that directly apply to your boutique and your business. Okay? There are 142 standards. ABC has 142 standards for patient care facilities. Chances are not all of those standards are going to apply to your business. Don't waste time with the standards that don't apply to your business. Use this tool, click it, print it out, just follow the standards that apply to your business. Don't waste time on the other ones themselves here. Good tool. So let's jump back to the patient care guide, okay? You heard me mention there's 142 standards for patient care facilities. Here we go. This is what we've done, and every single standard is in this guidebook. If you see the bold writing up here, PC.1.2. This is the standard in the bold. Underneath it, every standard, we have written a tip, a helpful tip, a hint, really basically saying exactly what the standard means to every single 142 standards there. Also in the guidebook is the Patient Care Accreditation Pre-Application Checklist. Now this is great. You walk through this before you send your application in to us. Now remember, because it's very important, once we get that application, be prepared for your survey, because once you've submitted the application to ABC, the survey can take place immediately. Now chances are it's going to take a little while for a survey to get there to see you. But for a first-time accreditation, we want to get there as quickly as possible to get you up and running as quickly as possible to start taking care of patients and opening your business. The second thing is, if, for example, we have surveyors, I'm going to talk to you about surveyors in a little while. We have surveyors all over the country. If let's say you're in Little Rock, Arkansas, and a surveyor is in town doing a survey for a different facility across town, well, we may get this work in. It takes us a couple of days to get the paperwork done after we receive your application, and we can contact that surveyor, say, you have the day off there, would you please go over to this business? And they can be there in just a few days. So what we don't want to happen is, and our surveyors sometimes hear this, is for them to show up for your accreditation survey, and the person there says, oh, we're not ready for you. So we're going to ask you, it's really important to be prepared before you send that application in. Now, if your renewal application is submitted on time, our survey will definitely take place prior to your accreditation expiration date. Very important there. Here's another tool that's on our website. This is Success Can Be Yours, and I speak with all the surveyors frequently. I get to travel all over the country, and I speak with the surveyors, and they share with me some of the issues that they find along with the accreditation surveys. Now, this piece reflects some of those, including one of our main issues, patient chart documentation. That's one of the issues that they find, one of the speed bumps that they find in a lot of their surveys. Please remember, you can't offer too much documentation. I'm sure you've heard this 1,000 times, but if it's not sufficiently documented, then in the eyes of the payer, it did not happen. Okay? No matter what you did, what fantastic work you do, I know you all do great work, but everything must be documented. Just talking about the patient charts being incomplete, or the evaluation in there, your practitioner's evaluation, your fitter's evaluation, the diagnosis, the patient's history, the assessment, goals, referrals, the formulation of a treatment plan, the implementation of the plan. detailed medical necessities with prescription, delivery of proof and instructions. Is there documentation that you've given information on follow-up care? Anyway, that's just one of the pieces that's on here itself. So let's talk about prepping for your accreditation, okay? There are a few points that are particularly important prior to applying for your accreditation survey. Remember, I mentioned before, we really want to make sure that you're completely prepared prior to applying for your survey. So if you're renewing your accreditation itself, we're going to reach out to you about 6 months prior to your expiration date. We're going to remind you by snail mail and email that it is coming up, and we're going to ask you to send that application 6 months before your expiration date. We want to make sure that the surveyor is going to get to your location. We want to make sure that if there's a corrective action plan that's needed after the survey has been applied and occurred at your business, that there is time that your expiration will not, that your accreditation will not expire. It's extremely important to us, extremely important to you too. So first-time applicants, like I said before, apply when you are ready. And that surveyor could come just about any time. So getting ready for this, when you're filling out your application, it's all in the details. Second point I'd like to impress is the importance of completing the application correctly. Okay? Now, please pay very careful attention to every part of the application. If you put your correct hours in, because if you put yourself in that you open up at 8 o'clock in the morning and you actually don't open at 9, well, that's going to be a problem because a surveyor may show up at that, and not just an ABC surveyor, but an auditor from any other organization can be doing that also. So we're going to ask you to please be specific on your scope of services for your primary location and your affiliate locations if you have those. If the application tells us you perform a service, and that surveyor is going to want to see evidence of that service. So please do not check off something that you don't offer. If you had a staff member who was able to provide that service and they're no longer there, please remove that, okay? Because the surveyor, if it's on the paper, surveyor is going to say, I'd like to see documentation that you do this. So this is also a great opportunity to offer us any information that we need to know. If you want to tell something to the surveyor and to ABC prior to them arriving, this is a perfect opportunity to do that. Now, once ABC has received your accreditation application, an email will be sent to you confirming that we've received it. The application is then reviewed and processed, and the accreditation staff, which sometimes can take approximately 2 to 4 weeks for that. So your survey readiness, we'd like to do. So now we've received your application. We're doing the paperwork on our end. What do you do now? Generally, the time it takes for your application, surveyor, I told you, it can take up to 90 days, but the time the surveyor gets there, as I mentioned before, sometimes it can be quicker, sometimes it can be much quicker. So what else can you do once you've been notified that the survey has been accepted? You continue to make sure everything is placed. Please review all the standards that apply to your business and inform the staff. This is really important. Let your staff know that a surveyor is going to be coming in. I do attend some of the surveys. Some of you have wonderful gatekeepers. We'll walk in the door, we'll introduce ourselves, and they say, no, you're not coming in. I'm not sure who you are if you're not the business owner. So please let them know that we're going to be coming. We're there to help, okay? This is a good time to review Success Can Be Yours. That is another one of our tools on our website. It is an ABC standard and a CMS standard, if you have CMS patients, that you must have a main contact and a backup contact. The importance of this can be shown. Let me tell you a little story with this. I was on a survey once, and I was down in Florida, and the surveyor and I walked into the business. We introduced ourselves, and there was a gentleman standing behind the counter wearing a pair of shorts and a T-shirt and a baseball hat. He didn't really look like he fit in the place, but we introduced ourselves, and he was very nice to us, and he asked us if he could make a phone call. Well, we said, of course, you can make a phone call. So he called the practitioner of that location who was in the hospital in the emergency room with a torn meniscus. He went in the middle of the night. He tore up his meniscus, and he still was in the emergency room. Well, what happened was the practitioner contacted this gentleman as a backup and said, would you please go in, open it up. I know a surveyor from ABC is going to come someday. There's no way they're going to show up today, but I need you to be there, at least do that. Then he didn't see any patients, didn't do any work. And of course, Murphy's Law, we did show up, but it worked out perfectly because while the practitioner was in the hospital for the few hours, we were able to start looking at patient charts and going over policy procedure manuals, starting to do the survey. It worked out fantastically. So you must have a contact and a backup contact. Here's something that's important that not a lot of people are completely aware of, and I don't think a lot of people take advantage of it, unless, of course, you need it. Blackout dates. ABC offers blackout dates. When you apply for your survey, accreditation survey, what we will do is we will offer you blackout dates. Remember I said you send in your application. If you know dates that you're going to be out, for example, you have a vacation, you're the business owner, and you want to be there for the survey, you're going to be out of town, you have a family reunion, you have a nephew getting married, you have something that you're not going to be there, let us know those dates. Please let us know, and what we will do is we will make sure a surveyor does not come to your business, your place of business, during those days. Now, what we require is we require at least a 30-day advance notice. If you know the dates when you send in your application, that is perfect. That is wonderful. Let us know those. If you don't know the dates, please contact us and email us with those dates, and make sure you get a confirmation that we have those dates, okay? Otherwise, the surveyor can show up at any point. And just a reminder, all the surveys are unannounced and unscheduled, and that is because we are deemed authority for Medicare, that we're not allowed to tell you when a surveyor was actually showing up. But once you apply, they can make it at any point there. So I'm going to spend just a few moments on the surveyors themselves. Who are the surveyors? Well, we have 30 surveyors nationwide. As I mentioned, they're all over the country. They travel all over the place. The surveyors coming to your boutique has extensive mastectomy experience. They also have years of survey training and experience. We have extensive training here. We're located in Alexandria, Virginia, across the Potomac River from Washington, D.C. We have continued training with our surveyors throughout the year. They get extensive training, and I know that very well because I sit in with those surveyors for that training itself. And one of the most important things that we feel is the consultative approach. It applies to your business, but it doesn't stop there. Their consultative approach is an asset to you and your team. They'll share advice with you regarding how to be compliant if they see issues. They'll also share suggestions and best business practices on how you can improve your organization. Now remember, they see practices and boutiques and businesses all over the country. Some of them they see are thriving very well and doing great jobs. Some of them they see can have room for improvement. And what they'll do is for example, if they see a practice and they see a boutique and someone's doing something that takes them 6 hours for that week to finish that task, they may see someone else at a different boutique only taking 2 hours because they're doing this and this, but they still get the same result. Well, that saves hours, that saves dollars, and they may have suggestions for you. You do not have to take the suggestions. Their main reason for being there is to make sure you are compliant with all of the standards that apply to your boutique and your business. But like I said, they see businesses all over the country, and they may have some suggestions with it. It really may behoove you to go ahead and take a listen to them and maybe try some of the suggestions they have. You don't have to, but it's up to you. So you walk in one morning, you open your door, you unlock the door, and you get ready for business, and a short while later, there's a knock at the door opens, and one of our surveyors is there. So what's going to happen? Let's take a look at the survey itself. Survey day. They're going to introduce themselves. They're going to have an ABC surveyor badge, and they'll be very happy to show you their credentials with that. What they'd like to do is they'd like to meet and greet your staff. They'd like to ask each staff member what their position is and what their responsibilities are. They're going to take a little facility tour. They're going to walk through and see your exam rooms and your fitting rooms and make sure you have an exit door, make sure all the lights and everything's working correctly. Just a real safety check as they go through that. They will need a workspace. They're going to need a place to sit down and either open their laptop or open up books and such. It can be a fitting room that you're not using that day. It can be an exam room. It can be a back room. It can be an office. Whatever you feel is best for them to use, that would be best. If you use electronic healthcare records, if you use electronic patient records, if you're at that point, they will need a monitor to go ahead and a computer to go ahead and get on those, to go ahead and review those. If you're using software that you purchase, whether it's OPI, Futura, or many other softwares out there, they're well versed on those. If you have created software for your own business, it'll probably take them 1 or 2 minutes to be prepared to work on that, and they'll get a good grasp of that. So it's no problem at all. They're going to ask to see your patient files for all staff members to review those. They're going to require and request at minimum of 10 patient charts per ABC certified fitter. If you have 3 fitters on staff, they'll need to see 30 patient charts, and that's a minimum. They'll ask for those. That'll be approximately between the last 6 months or within the last 12 months, depending on how much business and what kind of workload you have itself. They may ask you for some more patient charts once they've reviewed those. If they do, please don't flip out. Don't worry. They're just looking for consistency, so that's great. They may go through 7 or 8 of the charts and say thank you very much and give them right back to you, okay? If you have Medicare patients, if you have patients that are billing by Medicare, they're required to do 5 patient phone calls. This is something the new Medicare has asked us to do and CMS has asked us to do, and we're obliging with it. What they'll do is very simple calls, and if you would like to sit there with them while they make the calls, if you're free or a staff member, you're very welcome to do so. It's very simple. They'll call a patient and say, I'm calling from this boutique and this business. Are you a patient of theirs? And they'll obviously say yes, and say, did you receive such and such? And they say yes. Well, how is that working for you? Are you having any issues? Would you like to come back in and see your fitter again? Would you like to have a follow-up? And so if there are issues, what they'll do is they'll make sure that if they would like to come back in for maybe new merchandise or new fitting and new device, they'll let your staff know. If your staff isn't right there with them, they'll let your staff know so you can go ahead and call in and make an appointment with them. So it'll work a little bit on the marketing also with you there. So that's what most of the survey day is going to look like. They're going to look for documents, and they're going to ask for these documents. Your policy procedure manual, that is your living and breathing document where you make all changes. It needs to be available to all changes within your business itself. It needs to be available to all staff members, by the way. It can be a hard copy. It can be an electronic form, whichever the way you have it. It also, you can name it anything you want, policy procedure manual, employee handbook, whatever you call it, but they will be reviewing that itself. They're going to check to make sure that you have done your fire and your emergency drills and your review of those, your annual review of those. They want to see documentation of that. You should have a chart or a file for each of those. They want to make sure that you have a process for doing patient chart audits to make sure that everything is documented, nothing's missed in the patient charts. They're going to, and that needs to be done at least annually. Most businesses do it more often. They're going to ask for your patient satisfaction report and action plan that need to do at least minimally annually. And they're going to want to check to make sure you have a process for correcting billing issues. They want to take a look at that and that you have reviewed that within the last year. One of the positive things about these tools that I was talking about earlier is every single thing you see on this slide, ABC has created a chart or a template or an information page that if you don't have all these things set in place, we have created those for you. And I'm going to show those to you a little bit later on. So don't sweat it out. Don't worry about it. If you don't have all of this, we're going to help you with that. At the end of the survey, our surveyor will offer you an exit interview as your business owner or your chief mastectomy fitter. They're going to offer you an exit interview. I strongly encourage you, if you're able to sit for a while with the surveyor, to take advantage of this. If you're not able to, and if you have another staff member who is able to sit and take notes, I encourage that. Or a third option is our surveyors will very happily have a phone call with you at a later time. It could be the next day, the day after. Set aside a half an hour, and they can walk through everything with you. I really strongly encourage you to take advantage of the exit interview itself. But I want to make one thing very clear. Your patients come first. Please don't put your patient aside just to sit and do an exit interview. Exit interview can wait, okay? But please, if you're busy with a patient, take care of your patient first and then do the exit interview if the surveyor is able to stay with you, okay? So let's walk through this. They're going to review the general findings. They're going to review your partial and non-compliant issues. Remember all the standards? If you're compliant with the standard, there's no need to discuss that with you. But if you're partially compliant, they want to talk to you about that. Or if you're completely non-compliant, they want to discuss that with you also. This is your chance to share information with the surveyor. I was on a survey once. We were doing this exit interview, and the surveyor said to the business owner, "You're non-compliant in this area on this standard." And the business owner said, "Well, why is that?" He said, "Because we looked for this. It was supposed to be in this area, and it wasn't there." And the business owner left and came back 3 minutes later with a large folder and said, "Is this what you're looking for?" Surveyor opened it up, walked through it, said, this is perfect. This is exactly what I'm looking for. Just make sure you keep it in the correct place now. That's all. And so they went from non-compliant on a standard to compliant just like that. So this is your great opportunity to share information with the surveyor. And remember, I mentioned before, the surveyor may have suggestions for you. This is a great opportunity to go ahead and listen to those suggestions. So the surveyor is left. You've finished the day. You've wiped your brow. Everyone at your business gives each other big hugs and say it's over with. Now what? So your surveyor is going to review and complete the survey and send it to ABC offices once they're finished with it. Number two, ABC Accreditation Team is going to review it. We're going to validate it, and we're going to finalize your survey results. And number three, what we're going to do is we're going to mail your primary contact, your survey report, a decision letter. It's this whole package: survey report, a decision letter, and a summary of findings within 4 to 6 weeks. So what's in the survey report? One of the items you receive, as I mentioned, the survey report. What's in that survey report? It's going to indicate a score of compliant, partially compliant, or non-compliant for each of the standards for which your boutique was served. Remember, I mentioned before that the surveyor, right when they're there at your location, they're not going to say you're compliant, you're non-compliant. They're just going to say the partially compliant and the non-compliance. Well, this report is going to give you every single standard and tell you where you stand in each one of those. Now, the standard marked with the partially compliant or the non-compliant will include comments to assist you in taking corrective actions or, to the compliant to raise it up to the standard itself. Your decision letter will also inform you of a corrective action plan. Now, corrective action plans, sometimes we refer to those as CAPs, if it's needed. If you receive a request for a corrective action plan, it does not necessarily mean you didn't pass your exam. Please don't think immediately it does. It doesn't mean that whatsoever, okay? What it does mean is you'll need to show ABC how you've made changes to be compliant with that standard. Now, ABC is going to give you we're going to give you 45 days to make those changes. We're going to ask you to document those, send those changes, documentation of it, to us and the corrective action plan back to ABC for review. Now, if you have any questions whatsoever about your corrective action plan or any of this process, do not hesitate to contact us, and we'll explain exactly what everything is, okay? We'll be happy to explain it 100 times if we need to. At the end of this presentation, I'm going to go ahead and put up our contact information, so it'll be right there for you, okay? So, congratulations. Yay! Cheers. This is what you're going to receive. If you have a corrective action plan, you return it, you're going to receive this, okay? Once everything's done and you're good to go. This is your certificate. This is your accreditation certificate. Now, where should you place it? I'm waiting for answers. Someone speak up. Where should you place it? Of course, you're going to place it someplace where everyone can see. If you have 3 fitting rooms and you put it between the second and third fitting room, well, not everyone's going to go back to the third fitting room. So out in your lobby, out in your front area, that'd be a wonderful place to put it there. Okay, this is going to show everyone. This is number 2. This is your accreditation window decal and information about the ABC logo and how to use it. So you're going to get your accreditation decal right here. You can put it on your business, and you're going to get the logo and how you can use it. Many businesses put their logo on their website. I know a lot of people who are certified with ABC have their logo on their business card as well. This is a sample press release template. This is a fantastic piece basically saying, all right, we have gone through the entire accreditation standard. We have completed the survey. We are giving the high gold level standard of healthcare that can be provided. Who would you share this information with? Well, you want to share it with your referral sources, right? Your physicians, your hospitals, your VA centers, your cancer centers. If you're in a smaller location, I have talked to people who have taken this press release, you manipulate it, put all of your information in this template, and I've talked to people who have sent it to their local newspapers. Small town newspapers, they get an article done about their business in the local newspaper. Fantastic marketing. Excellent. So please, and also on our website, you'll get a link for this on our website where you can go ahead and do it electronically also. Okay? Right here, this is our ABC customizable brochure, and it's specifically developed for mastectomy boutiques. Your patient and referral sources may not know all about the hard work it took you to pass the ABC accreditation survey itself. So these brochures are designed by ABC and can be customized to meet your boutique needs. You can add your business information right to them before they're printed out. They're very professionally done. These brochures will help you share what the accreditation means to your patients, sometimes to your referral sources. They may not know what you've gone through to get to this high level of accreditation itself. Now, you can view these or purchase these pamphlets on our ABC website. They're right there for you. And like I said, they're specifically for mastectomy boutiques. This is something that we've created this year. This is just a calendar right here. This right here, you see the front page of the calendar. This is the kickoff for the accreditation compliance kit, which we have our guide, our calendar, and the resource pack. I'm going to talk about that a little bit. If you are accredited with ABC and you're coming up for renewal, you should have already received the 2015 calendar earlier this year. If you haven't, let us know. We'll send it out to you. And I know it sounds kind of silly. This is later in the year and receiving a 2015 calendar. It doesn't matter because this calendar is full of great accreditation information. Each month has different standards that we've taken and broken down. So instead of every 3 years for your accreditation, cramming everything and trying to be ready at the last minute, if you do something each month, you will be prepared throughout the year, not just for accreditation, but for the best healthcare possible you can provide itself. So if you've already received this and you've applied, you should already have this. But anyway, we'll get to you. If you don't, let me know. I will send you hard copies of it, as many as you want. This is the resource pack. This is on our website. Remember I told you that we've created a bunch of new tools? Well, that calendar was the first part, the accreditation guide, the calendar, and this is the resource pack. Right on our website, you'll see this little icon, the RP icon. Inside of that pack, we have created approximately 17 new files, templates, charts, information pages that will help you be compliant in all of the standards that ABC has. As you see right here, we have annual facility review checklists. As you can take a look at those, all of these forms are electronic version. If you have something like this you're already using in your business, that's perfectly fine. If you're happy with it and it's working, use it by all means. If you don't have something, please feel free to take a look at this and go ahead and use this. If you have something that you like and you see something in ours that you like, blend them together. Manipulate them however you would like. They're there for your use. And we're going to take a look at some of these as we go. Here's one of them. This is a patient chart audit form. This is just one of the templates that we created out of those 17. It's very simple. ABC, you need to do a patient chart audit at least once a year. And that's one of the standards, at least once a year. I know businesses that do it once a month, that they go through it once a month. This is to help with that. Basically, you take this chart, fill it out as you're doing your patient audit form, as you're doing your patient audits. And the first month you fill this out, you'll probably have some things that are missing on there. But I guarantee you, if you continue to do this, whether once every month or once every 3 months, however you're doing it, the more you do it, the less is going to be missing from your patient charts, and your documentation and your patient charts are going to be compliant. And this is great help. This is a wonderful help, especially when, remember, I mentioned earlier, with RAC audits and any other audits that are coming in. This is a fantastic form. This is just one of those. As we move on, privileging. I'm not sure if everyone knows what privileging is. Privileging is, I'm going to give you a little explanation. Many of our accredited providers take advantage of privileging. It's having an uncredentialed staff member, uncertified staff member, being able to perform services under direct supervision of an ABC certified mastectomy fitter. It's just that simple. Uncredentialed staff member being able to perform services under a direct supervision of an ABC certified mastectomy fitter. Now, what do we need for that? You can't just start doing it. We need a written objective criteria that is in the personnel file of the non-credentialed person. We need documentation of what their training is. They can't just walk in and start doing it. We need training. The training can be they've taken a course. The training can be that they have worked for the certified fitter for a couple of years and they have trained them themselves. It can be any of those, but we need documentation of the training, and then we need justification. We need documentation of justification. What is the justification? Why is this non-credentialed person able to provide these services under direct supervision. And why isn't the fitter doing it? Well, maybe the fitter can be doing something more extensive, and the non-credentialed person doing something not as extensive. That way you can save time and you can save hours, and maybe you can see more patients at once. Okay? So anyway, we need that. That's all in there. What ABC has done is we've created a privileging criteria template. Okay, we want to help you with this using the instructions for using privileging criteria template. This, we're talking about your written objective criteria, exactly what I was talking about. We have another form, exactly what was the person individually privileged in. Okay, we have the date. You fill out this chart. You put it in the personnel file, keep it in there as the patient's doing the as the staff members taking care of the patients. The surveyor comes in, looks through the personnel chart, sees this. They say, perfect, you're doing it exactly as you should. This is just a couple more of those tools that we've created. Who's doing patient satisfaction surveys? I hope every single person listening to this is. I'm sure you are. I have no doubt of that. Everyone needs to do a patient satisfaction survey. And who do you offer to? You offer it to every patient. Every single person, the patient that comes in, you provide services to, you offer to them. CMS does not have it that black and white, but they would like to see 33% of all patient satisfaction surveys given out returned and completed. I don't know how many of you are getting that. I don't know how you're providing it. If you're providing it electronically, that's wonderful. If you're providing it a hard copy in hand to the customer and patient as they leave, that's wonderful. If you provide it in more than one way, electronically by email or by hard copy, that's fantastic. The more ways you offer, the better opportunities you're going to have of getting that back. I do have a couple of hints here. I do suggest if you take a few moments with your patient and say, this is going to help us better prepare to be able to take care of our patients and provide better health care. We can't learn how to improve our business and our health care if we don't hear what we're doing well and what we need to improve on. I would just say something to the effect, put it in your own words, say, I would like you to be comfortable going to church and telling anyone at church if they need someone that for services we provided, you feel comfortable saying to us, your family members, anyone. And please take just a few minutes and fill this out for us. I really think you're going to get a lot responses to that itself. And this is another tool we've read, how to write and analyze a patient satisfaction survey itself. It's just one of the other 17 tools that we talked about. This is what we've done. We have also created a sample patient satisfaction survey. You may have one that you love. If you have it and it's working great for you, fantastic. If not, we have this, keeping it short and sweet, just to the point. What do we need to improve on? How was your visit there? What was your visit like? We want to hear about it. So you can use this tool also. We've also created a guide to patient satisfaction trends. So once all those satisfaction surveys are coming back and it's going fantastic and you're collecting them all, you're getting great feedback and all this stuff, what do you do with it? Well, with ABC, the standard says at least once a year you need to create a report and an action plan. Okay? This right here, this information page is going to help you with all of that information. It's going to walk you through it. It's a very beneficial tool. How about fire drills? Who's doing fire drills? Everyone who offers patient satisfaction surveys, I hope, is doing a fire drill. How often do you have to do a fire drill? What is the standard? At least once a year. Once a year you have to do a fire drill. If you have a one-person shop, do you still have to do a fire drill? Yeah, the answer is yes. The answer is yes. I have a little story. There was a practitioner who had a patient. It was a lady, and she came in with her 4 children, 4 small children. The practitioner was the fitter was taking care of the patient itself. Fire alarm went off. The fitter took the mother and the 3 small children and left and went outside of the practice. We're outside in the parking lot. Everything was fine, except it was the 4th child who started the fire in the closet. So we need to have a procedure. Even if you're a one-person shop, we need to have a procedure. Did you go through? Did you check? Did you check this closet? Did you open this door? Did you feel this door? We need to see what this is. So what we've done with that is we've taken, and I guarantee you the surveyors will be looking for the documentation of that. We've created another template. Here's the date, who was there, what time did it start? What time did it end? Tell us the timing of it. What was the scenario? Were there patients in your boutique when you had the fire drill? If you do have patients while you're doing that, it would be nice of you to tell them that this is a fire drill. Okay, be nice to them. Anyway, they'll be looking for that. So this is fire emergency and documentation. Also, I also encourage you to take a look and make sure that you have reviewed your emergency plan. Annually, you need to review emergency plan itself. With that, we want to make sure, is there any way you can back up your files if an emergency happens in your location? Is there a way you can forward your phones in case something, God forbid, happens to your location? How can your patients contact you? How can the hospital, the cancer centers, how can the VA centers contact you? Okay, you want to make sure you have an emergency plan for that, and it must be reviewed at least once a year. So, along with these templates and charts, this is what else we have created with that. Employee documentation chart, office and reception area review safety check chart, your annual reviews with your staff chart, patient and info forms, patient exam rooms, are they safe? Has it been reviewed at least annually? Your performance manual, your fire and safety, which we've already discussed, and your billing and coding. They want to make sure that you have a budget. They want to make sure that the clinical narrative matches the billing. If you have a process, if you have submitted a claim and it was rejected, you have a process to correct that claim and resubmit. If you don't, well, that's a red flag. And so the surveyors can be looking for that. I know no one on this broadcast is doing that, but we have created all these tools that are just going to help you so much walk through and be prepared for your survey and be prepared all year long itself. I pulled this up. This is our website. I wanted to show you exactly where everything lives. On our head page, on our front page on our website, main page, My ABC. Right there, the red box right up there, My ABC. You click on that and you put your information, your office's, your business's information, login number and password, and boom, all of these tools are at your fingertips. Yay. Now, this is normal time. We have questions, but since we're on YouTube and this is a broadcast, we don't have questions right now. But what I want you to do, if you do have any questions, in a couple of slides, I'm going to show you our website, I'm going to show you our contact information, and please do not hesitate in contacting us. We will answer as many questions as you need without a problem. But your best resource right here, abcop.org. I showed you our web page, our main page. This is how you get there, abcop.org. And this is our staff. Pretty good looking staff, isn't it? No, that's not our staff. That was just a picture we put up. But they're holding a very nice sign. abcop.org. Please visit us. Here's the contact information. This is my email. My name is Jim Lawson. Here's my email address, jlawson@abcop.org, or our entire accreditation department. Send an email to accreditation@abcop.org, or our direct line 703-836-7114. When your phone is answered, if you give us a call, they're going to ask you what your question is, because we have our accreditation team. We have different people on the team who are experts in different areas. So they want to send you to the correct person. Once again, don't hesitate to contact us. I hope this information has been beneficial to you. I strongly encourage you to go to our website and look at the resources and tools that we've created. The Accreditation Compliance Guide, you can download that in electronic form and print it out, or you can contact me. I'll send you a hard copy, as many as you need. Get that calendar, the hard copy of the calendar. I'll be happy to mail it out to you. Please don't hesitate. Once again, thank you so much for joining us today. Any questions, get in touch. You have a wonderful, wonderful day. Thank you again.